What is this peer-to-peer call that can affect your well-being and certainly your financial health? Welcome, I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. So today, let's review what is this peer-to-peer call, why is it important to you, and how to facilitate the best outcomes. The peer-to-peer call is a phone conversation between your referring, treating, prescribing, supervising physician and your insurance company's medical director following your insurance denial of an authorization request for a specific treatment, surgical intervention, procedure, device, prescription, etc. Now, these denials can have many reasons. For example, lack of medical necessity, meaning there is not enough or no clinical justification for the need for that procedure or service. Another denial could be experimental, investigational, meaning the prescribed treatment or procedure is not FDA approved, not considered safe and effective, not usually prescribed for your diagnosis, or not considered standard of care in the US. But it could also be a denial as not covered per medical policy. If your insurance medical policy does not include the diagnosis, or if a medical condition does not meet the standards required under that policy, a denial will be issued. As for being excluded or an exclusion, if that procedure or diagnosis are specifically listed as not payable and not covered by the policy, they will be rejected. Some common examples include cosmetic surgery, dental services under the medical policy, acupuncture, compounded pharmacy, wilderness therapy, and more. The peer-to-peer call is the opportunity for your doctor to explain to the insurance's medical director the specific and timely need for the service, procedure, device, prescription, and to clarify the rationale of the medical decision that the medical records may not have conveyed. It is the opportunity for your doctor to present additional clinical information, medical records, documentation to support and justify the level of intervention and treatment plan. Why is this the only or best option for you at this time to regain your health, maintain your current status, slow disease progression, or as a last resort, to prolong your life or quality of life? It is also the opportunity for the insurance's medical director to review those documents based on information on that call and overturn the initial denial. And if the medical director issues an approval, that can expedite access to that medical care. So let's get into details of what that means exactly. Well, if or when the insurance's medical director overturns the original denial after that peer-to-peer call, it means you can have that surgery, treatment, device, prescription protocol, and that it will be covered and therefore payable by your plan. Your insurance basically guarantees that claims relating to it will be processed and accepted and paid according to the terms of your policy. For example, whether your out-of-pocket maximum liability has already been met. But it also means you gain time, as peer-to-peer calls are usually scheduled within a week of a denial, and a response by the medical director can be extremely quick, sometimes during that call. You also avoid the need to file a written appeal, that request for reconsideration. That process can take a good week at best, That's if your situation is deemed extremely urgent or life-threatening. Otherwise, it can take 30 to 60 days for a response. But a peer-to-peer call also increases your chances of success. Why? Because a written appeal is reviewed by a regular reviewer, sometimes a nurse, mostly not, and certainly never by a medical director. And it often leads to a negative decision, as a non-medical or non-MD reviewer will usually never overturn the medical director's decision, even if they had more than 5 minutes on average to review medical records and rule on medical matters they have little training for. Now, a review by an external impartial medical reviewer is a right available to you and your doctor, but it often only happens at the second-degree appeal level, meaning several weeks down the line at best. And in many cases, that external reviewer may be someone hired and paid for by the insurance, begging the question of impartiality. There are ways to further improve your chances of success. First, make sure the right physician requests that peer-to-peer call. Only the referring physician can request it, even if another medical professional will ultimately render the service. It is the physician who originally requested the now denied authorization who has the right and duty to proceed. As for medical professionals, unfortunately, they are not equal. It is unfortunate that insurance's medical directors can and do dictate who they accept as a peer for that call. In my experience, MDs, DOs, doctors of osteopathy, PhDs, doctors of psychiatry are usually accepted without any problem. Sometimes accepted might be the prescribing nurse practitioner, physician assistant, doctor of naturopathy, licensed marriage and family therapist, other licensed clinical social workers, but never accepted are those who will provide the service but cannot or did not order it. Speech therapists, occupational or physical therapists, ABA therapists, but even facilities where surgery will take place, infusion centers, home health agencies, dialysis centers, etc. As for you, the patient, you have no right to a peer-to-peer or even to be a listener on it, even if you're an MD or the best person to know your own situation. Sorry, I'm not making the rules. But if your doctor cannot explain themselves and their decision to another physician, then I would personally have questions. The insurance medical director certainly would have little choice but uphold the initial denial. And if you self-procured the services, forget about requesting that call at all. You would need a physician to order the services and therefore defend their need. Timeliness is always important in healthcare. The time constraint to request a peer-to-peer call is always indicated on the rejection or denial letter issued by the Utilization Management Department. That's the department issuing authorizations. A call usually gets scheduled within 5 days from a request by the ordering physician. Some insurances allow a couple of weeks to file that request, but others only a couple of days. And yes, preparation and documentation are a must. The office of a referring/prescribing physician should send any additional clinical documentation or supporting evidence to the attention of a medical director ahead of a scheduled call to allow for a review and better discussion. And I will add my 3 rules of success. Keep it precise, concise, and to the point. Like Goldilocks, too much is too much. Not enough is, well, not enough. Just right is what gets you there. So although the peer-to-peer calls are out of the hands of patients, they should know about that option and should ask, or even pressure if needs be, any referring or prescribing physician to undertake one in case of a denied authorization. Not only does their health depend on it, but crushing financial consequences can then be avoided as well. I thank you for watching. Your likes, comments, and subscribes help this little channel grow a bit at a time to reach out to more patients like you. So thank you.